even for her, because we talk about it, there's a transition with the obvious symptoms, right? And that's the fallacy that needs to be we need to get rid of, because we only recognize things like hot flashes and night sweats. Mm-hmm. You never died of a hot flash, right? It's a siren. It's like, we're about to shut down, right? It's warning you, it's letting you know that things are going to change. It's the other constellation of symptoms, because the hot flash is like the tip of the iceberg. The symptoms underneath the water are the ones that are going to erode your quality of life. And you have got to see those things, and you have got to help to mitigate that. And it doesn't mean that, you were not depressed or anxious before, and all of a sudden you get through menopause and you die. That's not. Sometimes it's just an exacerbation. You've had some depression and anxiety before, but all of a sudden this kicks up 100%, right? Oh. And recognizing that, hold on a second, something has changed. Let me get my hormones checked. And again, hormones aren't for everyone. One of the most common scenarios we're dealing with is like a lot of women aren't consuming meat. So when we do a full panel and look on their levels, they're working hard, they're exercising, doing all the right things, and their iron is 2. I said, well, if your iron is 2 out of 300, you're going to feel tired, you're going to feel exhausted, you're probably going to feel a little bit depressed. And sometimes we can replace the iron, and they're like, well, I feel good, I don't feel like I need it, I feel balanced again. So a lot of it is looking at the whole person, incorporating the things that we can intervene on from a scientific perspective, and then taking it from there.
Explain to me how you explained it on the phone, that when a woman has a hysterectomy, that her chances of developing cardiovascular disease are less than someone who naturally goes through menopause, right?
So if you naturally go through, so it's higher, right? Because you're prematurely taking out so a hysterectomy means you're removing the uterus. That in and of itself, the function of the uterus is for baby carrying, right? We're talking about the ovaries. So an oophorectomy is almost a separate procedure, and we often get them mushed together, okay? And to be fair, in older days, women they would just whip out everything. Yeah. Just take a spoon and go, and then that was it. I mean, if you ask, I have patients in their 60s, and you ask them, why did you have their hysterectomy? I would dare say 75% of them go, I have no idea. My doctor said I should take it out, and so we have these pockets of women who've had hysterectomy, who've also had their ovaries removed, who now dive headfirst into menopause, right? That's the lemming on the cliff, like pitch myself off. And the reality with that is they have now gotten the postmenopausal risk factors at a much earlier age, right? And we definitively prove that in terms of bone health, in terms of development of Alzheimer's dementia, in terms of colon cancer risk, and in terms of cardiovascular disease. So it's important to mitigate. So, the other thing is, so we have patients, and especially for young women, that's important, because there are a percentage of young women who will go through what we call premature menopause. They'll go into menopause before the age of 40, okay? And it really is for those that we get to diagnose, it really is a mark of shame, because they feel like they're failing. So they often don't get the care they need, and they really need to be replaced to keep their longevity for multiple reasons.
So we've talked about the safety and perhaps why more women should use hormone replacement therapy. But what about just for our comfort? I mean, the reason I wanted to get these patients in here today and talk to them is just to talk about like how uncomfortable they were during menopause. Yes. It relieves a lot of the symptoms too, right?
Absolutely. It's all about quality of life, right? And it's all about us as women being a little bit more selfish and recognizing is that the more that we do for ourselves, it's the more that we offer, right? Yeah. And also, it's also about our self-esteem, right? Definitively, when you cut off somebody's estrogen, your skin, your hair, right? You're putting on weight, right? These are all things that play into how you feel, about how confident you feel. I mean, and that's a serious issue. The other huge issue, the big giant elephant in the room, is vaginal dryness, which is how we kind of got into this in the first place. Because your vagina is estrogen dependent, right? That makes sense. It's the one organ that definitively needs estrogen. So when you take that away, no different than when a man's balls will shrink if you castrate him, or you understand what I'm saying? That they're suffering because they have severe pain every time and in 2023, 52 is young. to be able to give up your sex life. Like that's unacceptable. But to think that you're alone or to think that your body is failing you is just unacceptable in 2023 when you can do something about it. And it doesn't always have to be hormones, right? But it needs to be addressed. 50 years ago, you were retiring, you were considering retirement. These women are running, they're running multi-million-dollar companies. They're at their pinnacle, but then they're going into a board meeting sweating.
Yep.
Unacceptable. Right? Unacceptable. And not only that, we have got to figure out how to keep them going as long as possible. We cannot let them out of the game because we happen to physiologically be going through these symptoms. It's not fair.
Yeah. Somebody told me it feels like you have the flu. And I was like, well, how do you keep working feeling like you have the flu all the time?
Yep. Absolutely.
That sounds terrible.
It's horrible. And then when the weight gain comes, then we start dieting and we start eating, but it's that balance that needs to happen because I would dare say 100% of my patients going through menopause. Let's say 99, because we have a couple of lucky ones. And they start with belly fat, and there's a physiologic reason. Oh, and incidentally, that belly fat is also linked to insulin resistance. So their diabetic risk goes up. I mean, the list goes on and on. There is no coincidence that these pathologies get worse after age 52. Add in the joint pain, especially if you've had a history of arthritis. I mean, it goes on and on. Now I'm not exercising. Now I'm not paying attention to my cardiovascular risk factors. Now I'm getting a heart attack earlier. And all of this can be mitigated.
But if they start to be persistent about getting treatment.
About dealing with these symptoms, understanding that they're part of and you have to see how much, it's going to be different for every single woman, right? Just because your girlfriend has this doesn't mean that that's right for you. It is very, very personalized. And so just recognition is huge, just awareness. You're not alone, and there's something that you can do about it.